You've been discharged from the maternity ward, your baby isn't moving their arm, and you're unsure about what to do? This video isn't about surgery. We have another video here on the channel that talks about that. Here, we're going to talk about rehabilitation and how to stimulate your baby's arm so they can achieve the best possible outcome. But doctor, how am I supposed to stimulate someone who's a baby and doesn't follow instructions yet? Well then, this is possible through stimulation. First of all, no slings. Why? A sling immobilizes the arm and prevents the baby from looking at or noticing the arm. In other words, the sling doesn't protect the nerve that's already been injured. And it doesn't help either because it blocks environmental stimuli that you can use to help your baby recover as quickly as possible. So what I recommend is this. Every day, at the same time, you should let your baby feel different textures on their arm. For example, you can use a warm compress, not too hot so it doesn't burn. You can also use a small piece of ice wrapped in cloth so they can feel something cold. And you can also use an object that tickles, for example, an electric toothbrush, one of those that vibrates, or even a piece of paper if you don't have an electric toothbrush at home. You're going to have them feel all these textures, starting with the hand, then the forearm, on the front and back, then the arm on the front and back, and even up to the shoulder. This makes the nerve, which has already reached the end, send information to the brain so it can start activating the movements that need to be regained. Another secret is this. When they start to regain movement, for example, bending the elbow, and you want them to improve that movement and do it more often, one of the secrets is to stimulate the joint responsible for that movement. That way, you get them to practice that movement even without them really understanding what you're asking them to do. You'll see that it works. Now, if it's a serious injury and movement hasn't returned yet, do it anyway. Why? Because you'll be stimulating to increase their chances of improvement. Another good thing to do is joint movements. Since they can't move on their own, you can gently open and close their fingers, open and close the wrist, being careful not to hurt them. If you have any doubts, ask a physical therapist to guide you on how to do it safely. In addition, bend the elbow and bring the little arm up here. This will help keep the joints mobile, and when movement starts to return, it will happen naturally, without joint stiffness. Attention, everything I mentioned here costs nothing. The only thing it will cost is your time, just a few minutes at home for you to do it. If you work a lot, split it up. One day the father does it, the next day the mother, another day the aunt, another day the grandmother. The important thing is this. The more you stimulate your baby's little arm, the sooner you'll see results. This is something to do every day. Besides that, physical therapy is extremely important. I'm not saying that if you do all this, you don't need to go to physical therapy. I'm just giving you a tip on what you can do in addition to rehabilitation. All of this will help your baby have a much earlier response and improvement. You may have noticed that there isn't much content about this on the internet. If you want to know more information and want me to post more tips on how to help you during this time, don't forget to like this video and follow our channel.